Sanjay Rajagopalan is a leader in the field of environmental cardiology. He's a director of the Cardiovascular Research Institute at Case Western Reserve.
The first point that I'd like to make is the exposures don't exist in isolation, right? This again goes back to the nonlinear systems framework, where when you examine it often exists in conjunction with things like noise pollution, a variety of different socio-economic disparities, shown on the left side. And on the right side, this is a paper published in Nature Medicine from the Stanford group. It goes to show the enormity of the problem that external environmental exposures have on health outcomes, particularly as it intersects with inequitable health in populations in this country and certainly in the rest of the world. And you can see that there are regions in the United States, unfortunately many of them in the rural South, that are associated with disproportionate health mortality, but also have high social deprivation index. Social deprivation, again, is in conjunction with a lot of other features that you see on the left side. People have been interested in the built environment because one can start taking data science approaches. This is did with spatial phenotyping, using Google Street Views and Google Satellite Views. You can feed all of the features that you get from a picture into a convolutional neural network and performed some analysis. And these two papers show, and one paper used Google Satellite Views and the other used Google Street Views. Both predict census tract level outcomes, a variety of different outcomes. This happens to be cardiovascular outcomes. You can use techniques like attention mapping to give you some idea of what these features correspond to. In this aspect, you can see highways and roads and railroads that correspond to disproportionate increases. I cannot do a talk on the exposome without acknowledging food exposures, which is arguably the most important lever to optimize health and environmental sustainability on the planet. And this is some work from Mozaffarian published in Nature Medicine not too long ago that shows 70% of all type 2 diabetes mellitus cases worldwide, 70% of these cases of type 2 diabetes are directly attributable to suboptimal diet. If you look at biodiversity, out of 300,000 edible plants, only 200 are used by humans, and 75% of world's food comes from 12 plants and 5 animals, right? Rice, maize, and wheat, providing more than 50% of calories. This is a very nice paper in the PNAS published by Clark et al. That contrasts of climate emissions and health, right? So you can see on the x-axis, relative risk of mortality based on data, and on the y-axis, the average relative environmental emissions. This is where the intersection of planetary goals and personal goals and health goals. And you can see that if you confine your diet every day to nuts, legumes, whole grains, and vegetables, and avoided unprocessed red meat and processed red meat, you'd be much healthier, and you'd also emit far fewer carbon emissions.